Hello guys, this video is about vaginal bleeding in pregnancy, and everybody knows that vaginal bleeding is not something you are going to sit with and to see if it is going to subside, because it is an indication most of the time that something is not right and you need to be checked immediately. Now, what are some of the causes of vaginal bleeding? This is what I want to discuss right now, and I want to categorize them according to trimesters. And in let us start with first trimester. So first trimester is between week 0 and week 12. And some of the causes of vaginal bleeding in first trimester is commonly miscarriage. Most people know miscarriage, so let's talk about threatened miscarriage. So with threatened miscarriage, one is going to experience vaginal bleeding, and aside of vaginal bleeding, they are going to complain about lower abdominal pains, they are going to complain about lower back pains. But what happens when you get to the hospital and you are checked? With threatened miscarriage, the child is still viable, the child is okay. And so the work of the healthcare provider is to sustain that pregnancy and prevent further complications. So one of the causes of vaginal bleeding is threatened miscarriage. Something else that is going to cause vaginal bleeding is abortions. So when you talk about abortions, it means that this pregnancy is coming out way before fetal viability, way before 20 to 24 weeks of pregnancy. So this child cannot survive even if they were to be taken into a neonatal ICU. So there is usually vaginal bleeding and other symptoms like lower back pain and abdominal pains, usually severe. And this abortion can be complete, incomplete, or sometimes inevitable, to mean that there's nothing that can be done about it. You know, the baby cannot be saved. In which case, counseling is done, and Another thing that is going to cause vaginal bleeding is what? Ectopic pregnancy. So ectopic pregnancy that is going to happen outside of the womb. So implantation of the pregnancy is happening outside of the uterus. Usually 95% it is going to happen in the fallopian tubes.